Assalamualaikum dear students, welcome to your channel The Anatomy Canvas, and in today's class I am going to discuss with you the histology of the trachea and the bronchi. So first have a look at this slide. As I have told you previously that the trachea is one of the part of the conducting system of the respiratory system, conducting part of the respiratory system. So also called the vent pipe. An important feature that it has many C-shaped cartilages, nearly 20 in number in human beings, and these cartilages they usually maintain the patency, especially during the forced expiration. So what about the histology of the trachea? So the tracheal wall consists of four layers. These are the submucosa, the mucosa, the submucosa, the cartilaginous layers, and then the adventitious. So in this slide you can see the mucosa consisting of epithelium, lamina, propria, and muscularis. Then the submucosa which is present over here. Then the cartilage layer which is present, and outer to this is the adventitia. So first concentrate on the mucosa. The mucosa basically formed by the three parts: the epithelium, the epithelium, the basement membrane, the lamina propria, and then the muscularis mucosae. So epithelium here in this slide you can see this is the pseudo-stratified columnar ciliated epithelium. Cells which are present in this epithelium are large number of the ciliated cell. You can see over here their number is nearly 30%, and in addition to this the mucous cells are also present, which are usually 28% in this epithelium. In addition to these two types of the cells, brush cells are also called, which are considered as the receptor cells. The small granule cells are present, which are one of the type of the endocrine cells, and also the basal cells at the basal location which are present, and these are considered as stem cells acting as a reservoir from which all other cells they regenerate. And another type of the cell is occasional intraepithelial lymphocyte. So what about the basement membrane? Another important feature, the basement membrane, this is usually very thick basement membrane in trachea. It is the characteristic feature of the tracheal epithelium that there is the thick basement membrane, and electron microscopy shows that this thickness is not because of the thickness of the basal lamina, but it is because of the thickness of the reticular lamina, which is part of the connective tissue. This reticular lamina is unusually thick in trachea and even become more thicker in cases of the smoking. So this in the light microscopy appears as the basement membrane, and in light microscopy we can see the thick basement membrane. Another important point here, you can see this is the ciliated epithelium, and at the base of the cilia you can see a dark pink color line which is present. This line shows the collection of the basal bodies from which the cilia are originating. So these basal bodies appear in light microscopy as the thin line which is eosinophilic in color. Then the next to this is the lamina propria, and this lamina propria contains large number of the lymphocytes. This is a loose connective tissue. It contains blood vessels, nerves, lymphatics, and large number of the lymphocytes. So here again a beautiful diagram of the trachea, and in this trachea you can see first label as one, this is the mucosa. This mucosa in turn consists of the epithelium, which is pseudo-stratified columnar ciliated with goblet cell. Then is the lamina propria, which is loose connective tissue, and then here is the lamina muscularis mucosae, or lamina muscularis of the mucosa. Then from this point to this whole area is the submucosa, and this submucosa contains the glands which are present in submucosa. This one is the duct of the gland. Then is the third layer, which is the cartilage layer. This is fibroelastic layer, and outer to this is the adventitia. So another point you must remember over here, that at the junction of the mucosa and submucosa there are large number of the elastic fibers which are present, and these elastic fibers require special staining for the elastic fibers. To see, we cannot see these, we cannot appreciate these elastic fibers with the H&E stain, and they usually form an elastic membrane over here. That's why we can differentiate between the two. So here in this slide you can see the epithelium, also the cilia which are present, and at the base of the cilia you can see basal bodies are present, and in light microscopy collection of basal bodies appear as a dark apical line over here. Then in this slide you can see this one is the epithelium, then the lamina propria, then the muscularis mucosa, and then the submucosa. So another point you should know over here that as in other places, the submucosa is the moderately dense irregular connective tissue, but in case of the trachea, it is usually loose connective tissue which is containing gland, and that is why it is difficult to differentiate between lamina propria and submucosa over here. Then you can see large number of the glands which are present in the submucosa. These glands are either mucus acini with the serous demilunes, or mucus gland itself, or the serous glands. So the mucus, the serous, and mixed, all the three types are present in the submucosa. Here you can see the scanning electron micrographic picture of the tracheal epithelium. So in this you can see this cell, these cells, these are the ciliated columnar cells. They have the cilia at the apical area and basally located nucleus. In between the ciliated cell you can see the goblet cell which is present, and this goblet cell is containing large number of the mucus granules which are present over here, mucus droplets, and these cells are the basal cells which are present over here. Then another beautiful diagram, this is the scanning electron micrograph, and this one is the light micrographic picture with H&E stain. So here is the epithelium, pseudostratified columnar ciliated with goblet cell, then the lamina propria and basement membrane, and this one is the lamina propria, and here you can see the mucosa over here, and this mucosa also containing the glands which are either mucus type or the serous type. This scanning electron microscopic picture shows you large number of the columnar cells with the cilia which are present over here, and in between the ciliated cell you can see the goblet cells which are also present. So now moving on to the submucosa. Submucosa also contain thick elastic membrane present and boundary between lamina propria and submucosa. As I have told you that this is the submucosa here, and this one is the lamina propria, and at this level there should be a boundary line formed by the thick elastic fibers which need special staining techniques for the elastic fiber. Outer to this is, you can see over here, that this is the hyaline cartilage. So submucosal glands either mucus or serous or mixed type. You can see this one is the mixed gland, this one is the serous gland, this one is the mucus gland. So numerous, basically usually present on the posterior aspect. Here again you can see this one is the epithelium, then the lamina propria, then the mucosa, submucosa, and the submucosa containing large number of the mucus gland, and then the cartilage layer. Again over here you can see the mucosa, the submucosa, cartilage layer, and adventitia, also called the fibroelastic tissue. So here you can compare, this one was the trachea, and there here you can see it is the ending of the C-shaped cartilage over here. This is usually present posteriorly, where large number of the glands are present in submucosa, and this is the picture of the lung, in which you can see the section of the bronchiole. So this slide is also very important because it is taken from the posterior aspect of the trachea, where usually cartilage tissue is not present, and where the cartilage usually ends, between the two ends of the cartilage you can see the smooth muscle are present, and the smooth muscle also called the trachealis muscle. This is also important feature which is present posteriorly, and also you can see over here large number of the glands. These are the mucus secreting glands, also the some of the serous secreting glands are also present. So this slide is basically that of the trachea taken from the posterior aspect. Then moving on to the further segments. So trachea immediately divides into two main bronchi. So please remember, the structure of the main bronchus usually resemble that of the trachea unless it enters into the tissue of the lung where its character changes. So these are the main bronchi which usually resemble histologically to that of the trachea. Then when it enters into the lung tissue, they become the lobar, then they become the segmental or the primary, secondary and tertiary, and ultimately ending as the bronchiole, then alveolar ducts and alveoli. So bronchial tree, first the bronchi. So important point, the cartilage which is present in the bronchial tree, it is not like a C-shaped cartilage which is present in the trachea, but there are the pieces of the cartilage which are surrounding the lumen of the bronchi. Also the glands are present. The smallest diameter may be 5 millimeter. Many lymphocytes are present. In contrast to bronchi, when we reach at the level of the bronchiole, usually diameter is less than 1 millimeter, there is no cartilage and no gland. Then bronchiole lead to alveolar ducts and then to alveolar sac and alveoli where gases exchange is taking place. So first of all, we will do the bronchial tree. Here the cartilages in the trachea, they are C-shaped. In the bronchus, they are present in the form of the plates, and at the level of the bronchioles, they usually disappear. So these are important MCQ must memorize. Then a very important thing, that in the level of the bronchi, the smooth muscles appear, and they begin in bronchi and they become more prominent in bronchiole, and after that they disappear. Epithelium, again very important, you must remember that at the level of the trachea and then the main bronchi, the principal bronchus, the secondary and the tertiary, it is usually pseudostratified. When it reaches the level of the terminal bronchiole, it becomes simple columnar ciliated, and at the level of the respiratory bronchiole, it becomes cuboidal, which later on becomes squamous in shape. So there is a gradual change in the epithelium. Here you can see, this is the slide, a section of the bronchus. Here you can see the epithelium. Then outer to epithelium you can see the smooth muscles which are present, and then the plates of the cartilage which are present. Surrounding tissue is that of the lung. So whenever you are looking at the slide of the lung and you identify the cartilage, you must know that this is the structure of the bronchus, because bronchiole do not contain the cartilages. Again, this is another section from the bronchus. Here you can see the epithelium, which has now become the simple columnar, and outer to this you can see the smooth muscles which are present, and these areas, this one, and this one, these are three areas are the cartilage plates which are present in the bronchus. So these points identify that this is the bronchus which are present in the tissue of the lung. So this is important point to memorize. Here you can see also the segmental or the tertiary bronchus, where you can see epithelium becomes simple columnar, and then the smooth muscles are present beneath it. Then you can see the cartilage plates which are present. Here you can see a section of bronchial artery which is present, a ganglion, and the glands which are present. So basically we have to we have main focus over here, which is the wall of the tertiary bronchus. Now moving on to the level of the bronchioles, this is a very important MCQ, that when the diameter becomes 1 millimeter or less, it is the bronchiole. It has lined by the simple columnar ciliated epithelium. There are no goblet cells. This is another MCQ. Clara cells first appear at these levels. There are the prominent smooth muscle cells in lamina propria. There is no cartilage and no glands in the submucosa. These are again your MCQ. You must memorize 3-4 MCQs related to this level. Are first the diameter 1 millimeter or less. Second, the epithelium, which is simple columnar. Third, no goblet cell, no cartilage, and no glands in submucosa. Fourth, Clara cells first appear at this level. And fifth, the prominent smooth muscle cells in lamina propria. So here you can see the transition from bronchus to bronchiole. This level is the bronchus. Here you can see the cartilage plate which is present over here, which help you to identify that this is the section of the bronchus. From here, when we move on to this area, there are no cartilage plates over here, and again smooth muscles are also very important in this area. Also, you can see in this area the glands are present which are not present at this level. So glands are absent in bronchiole, cartilage is absent in bronchiole, while these are present over here. So this is the section of the bronchiole which is lined by simple columnar epithelium which is ciliated in nature, surrounded by the very little connective tissue and then the smooth muscle cells, and outer to the smooth muscles, as you can see, the lung tissue which is present. So next is the conducting respiratory junction, the junction at which the terminal bronchiole become the respiratory bronchiole. So respiratory segment begins at the level of the respiratory bronchiole, and then the alveolar outpocketing and then the clara cells, they predominate at these levels. So this is in an important slide. Here you can see the different types of cells which are present in respiratory bronchiole. These are first the most important cell, the ciliated columnar cell, the most common. Then the clara cells which are present over here, and these clara cells containing granules which release the surface active reagent over here. Here you can see the nerve terminal which is present. This one is the brush cell having the blunt microvilli over here, and this is one of the type of the enteroendocrine cell. Also you can see the tight junction in these areas. So the respiratory bronchiole gives off alveoli. Here you can see this whole area. This one is the respiratory bronchiole. From the respiratory bronchiole, alveolar ducts starts, and alveolar ducts, either they do not have their own wall, but they are formed by the adjoining alveoli which are present over here. So you can see the alveolar sacs which are forming the wall of the alveolar duct. So this one is the respiratory bronchiole, the alveolar duct, and these all are the alveolar sacs and alveoli. So you can identify, this is important to identify the segment. So you can see this area is the basically the alveolar duct which is present, and these smaller all are the alveoli which are present, and here you can see the respiratory bronchiole. So respiratory bronchiole, important point to remember which are important from MCQ's point of view also. Sac-like alveoli along the wall. It has sac-like alveoli along the wall. The epithelium is ciliated cuboidal now. No goblet cells usually. Clara cells are present. No cartilage. Little smooth muscle. No submucosa. As you can see, these are the alveoli which are present over here, and this is a little bit the section of the respiratory bronchiole surrounded by the here is the epithelium of respiratory bronchiole and the smooth muscle, small amount of smooth muscle which is present. In this slide, you can see the alveoli and its lining epithelium. Very important, you may have heard it 100 times that alveoli are lined by two types of the cells, the type 1 alveolar cells and type 2 alveolar cells. Type 1 alveolar cells are the flattened cells. They usually are lined up to 97% of the surface area, and type 2 alveolar cells are the surface active secreting cells which are present over here. Although the number of the two cells is equal, but because of the differences in size, they cover nearly 97% of the surface area. So here you can also see the alveolar duct and the alveoli which are present. So this one is the alveoli and is lined by the type 1 alveolar cell and the type 2 alveolar cell. And this area is the alveolar septum, interalveolar septum which is present. So alveoli and the blood gas barrier, the epithelium of the alveoli and the capillaries become very thin, and basement membrane of the two epithelia usually fuse to each other, forming the thin barrier. Here you can see this at this slide, at this level, that this one is the lumen of the this one is the alveolar sac, and it is lined by the simple squamous epithelium, the type 1 epithelial cell, and then is the basement membrane, and then here you can see this one is the blood vessel and the basement membrane of the endothelium, and then endothelial cells. So different points which you can see first, the alveolar at this level, which is called the blood-air barrier. It is formed by first the endothelial cells, the alveolar cells itself, then the basement membrane of the alveolar cell, basement membrane of the endothelial cells, and endothelial cells themselves. So this one is the barrier through which the gas exchange usually take place. But another point you must remember over here, that this is the thin barrier. At certain places, there is a large number of the connective tissue is also present, which is forming this area as thick, and at such places we call it as the thick interalveolar segment. Usually the gas exchange is taking place at this level where this barrier is thin. So here you can see in this slide again the bronchiole, which are lined by the simple columnar epithelium over here. Here you can see lamina of the arteriole, and these are the alveolar air spaces which are present in the surrounding area. So this is another slide, very important slide from your OSPE as well. So this is one of the easiest slide in the first year where you identify the lung. So large number of the alveoli and the alveolar ducts are present in this area, in addition to here you can see the respiratory bronchiole. So this one is the terminal bronchiole, the respiratory bronchiole, and then the alveolar duct, which is present over here. This one is the alveolar duct, and then the alveoli. So very easy slide, but must remember, please, dear student, that usually you mistook this slide for the adipose tissue, because because of these alveoli, large of the areas are clear, so you mistook these alveoli as the fat cells. So be clear in your mind that these are the alveoli, not the adipose tissue. Here you can see very important, that is the thin segment of the interalveolar septum. Here you can see this one is the lumen of the alveoli, lined by the cells, the flattened epithelial cell, then the fused basal lamina of the epithelium of the alveolar sac and the endothelium, and then the endothelial cell. So this area is the area where thin segment is present, and this area is the area where the thick interalveolar segment is present, where you can see large number of the connective tissue as well. So again, a very beautiful slides you can see over here. So these are the bronchiole. If you are able to see the cartilage pieces over here, then it will be bronchi, and if you are unable to see the cartilage pieces over here, then it is the bronchiole. So please memorize it. Here you can see the cartilage piece. These are the different alveoli with the respiratory bronchiole and alveolar ducts present over here. And that's all about the today's class. Thank you very much for your attention, and Allah Hafiz till the next class.